women seeking an abortion be offered an ultrasound. This bill mandates that if a woman chooses to view the ultrasound image, it shall be provided to her in a respectful and understandable manner, without prejudice, and intended to give the woman the opportunity to make an informed choice.
Morning, Louise Hart, from Lincoln County, representing the Virginia Society for Human Life, and we support this legislation. Thank you so much.
Thank you, ma'am.
Good morning. My name is John Kuda. I'm a practicing physician in the community hospital here in Henrico County. I'm board certified in internal medicine, diagnostic radiology, and neuroradiology. And I oversee and interpret a wide variety of radiology studies, including ultrasound examinations of pregnant women, and I am here to speak in favor of this bill. When physicians obtain informed consent from patients, we talk at length about the intricacies of the procedure. We explain all the risks and the benefits of the procedure in detail and explain how the procedure will help that patient. This detailed explanation, which is being provided by this bill, makes the patients have an informed choice with all of the available facts. Physicians are legally and ethically bound to give our patients this information. Ultrasound examination allows a woman to better understand the process of terminating a pregnancy by showing her a close evaluation of both her uterus and the fetus. Today, women who seek termination of pregnancy are not given all the facts regarding the procedure. A woman should be given all the present-day information available to her so she can make an informed choice. We're putting women and their healthcare providers at risk if we do not allow them to have this information. Now, the ultrasound examination allows for exact dating and location of the fetus, of the baby. Without this ultrasound, the fetal age is a general estimate. I myself have seen several times, at least in a month, 2 times, where people have been estimated to be at least 4 weeks less pregnant than what they were. And so this can cause a problem not only legally, but a problem for the mother's health, as well as being much more dangerous to the baby if it was born alive. Now, the cost of an ultrasound examination to a pregnancy clinic can be as low as $40 a patient. And many pregnancy resource centers provide this service for free. There is a for-profit ultrasound center in Charlotte, North Carolina that will provide a 15-minute walk-in ultrasound examination for only $99, and that's a for-profit corporation. Figures are sometimes quoted that it will be up to $600 for an ultrasound examination for a prenatal examination. And that is for an hour-long ultrasound examination which will diligently look for congenital problems in late pregnancies and are much more time-intensive than what is being proposed. That is not the problem. $600 is not the type of ultrasound examination that we are talking about. The cost of an ultrasound is also covered oftentimes by health insurance. Now, the cost for an abortion is oftentimes up to $100 per week of gestation, so that 12 weeks of gestation may cost up to $1,200. So the cost of $40 for an ultrasound examination is minuscule compared to the cost of the abortion. The additional cost is a small percentage, and if the clinics are sincerely in the business of providing help for women, if they're sincerely in the business of providing help for women, this $40 could easily be absorbed by the clinic that is providing the abortion, or even written off by the clinic. Now, clinics are sincere. They could provide easily attained, up-to-date, detailed information about the pregnancy so that the woman can make a fully informed decision about what is going to be happening. Therefore, for the safety and full informed consent for the woman, for the legal and procedural safety of the health provider, I am for this bill.
Thank you. Thank you. Yes, Senator Howe.
I'm wondering if the doctor would take the question.
Yes,
Will you accept the question?
I'll take any and all questions.
Senator Howe.
Thank you. After you have discussed with the patient and gotten informed consent, and the patient says that she would want to have the choice of an abortion and she wants an abortion, would you perform it for her?
I myself personally would not. For a number of reasons. I'm not qualified, not trained. I have ethical problems with that situation as well.
Mr. Chairman and members of the committee, my name is Jessica Zhang and I represent the Family Foundation. This Senate bill is, it updates Virginia's informed consent law with modern technology. It is very pro-woman, and ultrasound provides for a safer abortion in the sense the gestational age of the child is known and not guessed. By removing the guesswork, a doctor can avoid possible prosecution and refer the woman to the hospital if the gestational age is beyond 13 weeks. Senate Bill 1435 provides for medical as well as legal responsibility, safety for the mother, and a truly informed consent. Mr. Chairman and members of the committee, I urge you to vote yes on behalf of the Family Foundation and its constituents. Thank you.
Mr. Chairman and committee, after studying the history...
Ma'am, if you would
Yes.
identify yourself.
I'm so
please.
sorry, Terry Beatley from Spotsylvania County. After studying the history of Planned Parenthood's policy agenda over the past 3.5 years, 1 year ago on December 1st, I aligned an appointment with Dr. Bernard Nathanson, who is the founder of NARAL. I flew to Manhattan, New York, and I visited with him at 4 o'clock in the afternoon because I wanted to know why the founder of NARAL back in 1969 or 70, who had been an OBGYN, who helped overturn the anti-abortion law in New York, why he had been pro-choice for so many years, and what changed his heart to being pro-life. I am absolutely in support of the bill because of what the founder of NARAL said. What he said was that when a woman sees her baby on ultrasound, 85 to 90% of women will choose life. In 1973, he became pro-life after aborting 5,000 babies personally himself and overseeing another 10,000. And he ran the clinic 24/7. So lastly, he said, Terry, my words to the world, he said, I'm 86 years old, I'm feeble, I cannot leave my apartment. But I said, Dr. Nathanson, as the founder of NARAL, who is now pro-life, what is your message that you want me to take to the rest of the world and right back to my legislators in Virginia and to my Senator House, because I now live in your district? And he said, Terry, we go back and convince them that this is a baby and we must love one another, and abortion is not love. So I say, support that bill. Give these women a chance, because what they live lives of regret. And when you vote to kill this kind of a bill, it harms these women and it obliterates the life of the baby. And I say thank you for gentlemen and ladies who will vote for this bill. From Dr. Bernard Nathanson, thank you.
Thank you, ma'am. Size and non-repetitive. Yes, ma'am.
Mr. Chairman and members of the subcommittee, my name is Jessica Halty, and I'm here today representing Planned Parenthood Advocates of Virginia. Planned Parenthood is committed to the highest level of care and comfort for all of our patients. Our doctors provide high quality and evidence-based medicine. Mandating an ultrasound be performed 24 hours prior to an abortion procedure places an undue burden on the woman that could cause delays and barriers to accessing abortion services. In the informed consent section of the Code of Virginia, 18.2-76, it clearly states in B4 that the statement of the probable gestational age of the fetus at the time the abortion is performed shall be provided to the woman. Additionally, women must be offered the opportunity to view materials, in subsection D, that inform the women of the probable anatomical and physiological characteristics of the human fetus at 2-week gestational increments for the time when a woman can be known to be pregnant full term. Whether or not to view an ultrasound is a personal, private decision that should be made between a woman in consultation with her healthcare provider. The cost of an ultrasound may not be covered by insurance and would require that woman cover this expense out of pocket, an expense that could be several $100s. Further, a woman living in a rural area may be unable to find a physician who can perform an ultrasound within that 24-hour time period, a requirement that is outlined in the informed consent law. For these reasons, we ask that you oppose this bill. Thank you.
Okay, Mr. Chairman and members of the committee, Kathy Grenier, and I am with the ACLU of Virginia Women's Rights Project. We oppose this bill. This law could force physicians to communicate and could coerce women to receive state messages aimed at influencing the women's decisions about whether to continue or terminate their pregnancies. The insertion of the state into the communications between physician and patient intrudes on a woman's autonomy and dignity, interferes with the physician's professional practice, and corrupts the informed consent process. Women should receive unbiased information about their healthcare options, but this bill interferes with the doctor-patient relationship. It puts government into the examination room and lets politics come between a woman and her physician. This bill distorts the principle of informed consent. Informed consent is already standard medical practice, and we support providing women with the opportunity to ask questions and receive unbiased information. As with any other medical procedure, women sign informed consent forms, have the opportunity to discuss risk alternative procedures and follow-up care prior to the abortion procedure. I'll speak to the constitutional implications of this bill. For us at the ACLU, it's troubling given that it curtails a woman's constitutional rights to privacy and liberty by subjecting her to possibly unwanted and unnecessary medical procedures. Thank you.
Good morning again. My name is Serena Keene, and I'm with NARAL Coach West Virginia. And we are here to oppose the bill. There are several reasons why you should not support this bill. Number one, if you take a look at the code, section 82.2-76, and look at B4, there is already a requirement that women be given a statement of probable gestational age of the fetus at the time of an abortion. Number two, several OBGYNs, nurse practitioners, and web research have told me time and again that ultrasound is not the most accurate way of determining gestational age. Number three, no other medical diagnostic test is mandated in the Code of Virginia. This would be the first, which would clearly open up the door to other medical procedures being required or mandated by the government. Number four, it undermines a doctor's autonomy for determining the best care for his or her patient. And number five, it can be cost prohibitive for many women. Who pays for this ultrasound? When I checked with OBGYNs in Northern Virginia, Hampton Roads, and Richmond, I found prices ranged anywhere between $300 all the way up to $1,200, depending on the location and the physician. That's a lot of money. And a first trimester abortion averages around $400, so just you can add that up and see how much that costs. Do we require women who are carrying their pregnancy to undergo an ultrasound? We don't. In fact, many health insurers will not cover unnecessary ultrasounds or any other procedures for that matter. This bill targets all women, but low-income women in particular. Thank you so much for your time, and I urge you to oppose this bill.
Somehow, at least 14 states have already made similar legislation work. Neither the medical community nor the abortion industry has collapsed under the weight of the requirement.
Is there been moved and seconded, the bill be reported? Senator Saxon.
Substitute motion is that it be passed by adoption.
Is there a second? Discussion on the motion to PBI. Hearing none, all those in favor of the motion to PBI signify by saying aye.
Aye.
All those opposed.